Hi, I'm Dr. Jack Zigler. Welcome to the Texas Back Institute. Today I'd like to talk to you about disc replacement, which is the process of surgically removing a damaged disc from the spinal column and replacing it with an artificial one. Disc replacement can be a wonderful alternative to fusion. In a spinal fusion procedure, the vertebrae above and below the damaged discs are locked together, essentially forming one large vertebra. This can cause a loss of mobility and may add stress to the next spinal segments, resulting in accelerated degeneration of the discs above and below the fused section. With disc replacement, our goals are to preserve motion while getting you back to normal activity more quickly. By replacing the damaged disc with an artificial one, we are able to provide our patients with a motion-preserving alternative to spinal fusion, because flexibility really matters.
I had 4 or 5 different consultations with orthopedic surgeons, neurologists, different doctors all over the Metroplex, trying to figure out what was going on. We did MRIs, X-rays, nerve tests, all this stuff. Their option to me was fusion done. I'm not going, no, that's not an option, because I want to be able to move, I want to be able to work, I want to be able to play golf. And I understood that once you had fusion done and you tried to play golf, you had the range of motion was limited, but then you wore out the disc above and below that. So I said, that's not an option. What else can I do? Where else can I go? But they sent me to Dr. Zigler at the Texas Back Institute.
At the Center for Disc Replacement at the Texas Back Institute, we have led the way in advanced spinal procedures since 1977, and we were the first institution to perform a total disc replacement in the United States through an FDA-regulated trial. We've performed over 1,500 disc replacement procedures over the past 10 years. Our surgeons and staff function as a center of excellence. As a highly academic private practice, we integrate the best of science and education, which allows us to offer our patients the newest technologies available. This philosophy serves as the backbone of our success. We provide our patients with the best, most personalized care possible. Our expert medical team and compassionate support staff continually strive to assist and educate each of our patients with individual attention. Our unique concierge service will not only provide each patient with answers to any concerns they may have about their procedure, but they can also help with hotel, travel arrangements, and any other personal needs that may arise. Disc replacement is approved for use in the neck and lower back. It starts with an incision made either in the front of the neck or the belly to expose the damaged disc. That disc is then removed and replaced with an artificial one. The surgery typically takes between 1 and 2 hours, and most patients are up walking shortly after surgery. Most patients are released from the hospital within 1 or 2 days.
Got up that afternoon, walking around, went home the next day. In 3 weeks I was working out, doing my rehab, going to the gym, working out myself, and in 6 weeks I was playing golf.
I admit there were times I wondered if I'd ever be able to do this again. 4 months after surgery, I was able to run a triathlon with the flexibility I needed to continue moving forward.
Each procedure is performed in a way that has a minimal impact on the patient, which includes minimal blood loss and shorter operating time. This results in less time in the hospital, and our patients get back to their lives faster than with traditional surgery. Disc replacement surgery can benefit patients suffering from herniated discs, degenerative disc disease, and even some patients with leg or arm pain. The bottom line is, if you've been told you need a fusion, you owe it to yourself to come to the experts at the Texas Back Institute's Center for Disc Replacement to find out if you're a candidate for this life-changing procedure.